Good afternoon, America. Hope you're having a great day. Hope it's warm and sunny where you are. It's a little cold and rainy here in Colleyville, Texas. This is Rick Redalen, the Maverick Doctor, and I'm hoping you'll spread some of the word that I have to give you about medicine. Let's talk a bit about the Oxycontin Crisis going on in the United States today. How do things like that happen, and why do we let it happen? And who do we blame for things like this? Do we blame our senators and representatives? I guess we do know that there's one senator from Utah that has received several $100,000 for getting a bill passed that makes it very, very difficult for our FDA to crack down on illegal shipments of narcotics going out. One of the problems the United States has is we're one of two countries in the world that advertise medications constantly. And how safe do you think these medications are? You see a medication that says this might help your heart, but then it goes on and gives about 20, 30 disclaimers that take up most of the time of the commercial, telling you all the bad things that might happen all the way up to death. Why do these drugs get passed by our FDA? Is our FDA just one more part of the money-making machine today? I do not think that in the 50s and 60s medications like these could have ever made it on the market with all the bad results they get. But I suspect that our FDA is being paid as handsomely as our senators and representatives are to get these bills passed. Right now, we have no control on the Oxycontin going out in the market. President Trump is trying to do a number of things to try to cut down on this. He can use all of our help, and that means Republicans and Democrats, independents. All of us should be helping our president. And again, if you don't think you should help the president and you're any kind of a Christian at all, pull out your Bible and read Romans. It is God who picks our leaders, and we are to support them, whether we agree with them or not. We have to make up our mind that the right things are happening. We know things are good that are happening in the United States right now, and we know that we are trying to get a handle on this Oxycontin crisis. You may be interested in knowing that there's only one other country in the world that allows all their medications to be plastered on television every day. Us two countries, New Zealand and the United States, we two countries I should say, New Zealand and the United States allow our young ones to be barraged from the time they can watch television until the time they die to say there's a pill for everything. Why is it that the United States uses 45% of all the pharmaceuticals produced in the world, and we make less than 5% of the population of the world? Why is that? And if medications are so good for us, why do we not have longevity like the rest of the countries in the world? Why do we lag behind everybody? Why are we so far behind in so many things? I talked to a doctor from Sweden some time ago at a HIMSS convention and asked him, was there anything amazing you learned at this convention? He said, there's one thing that just about knocked me over completely, and had somebody come back to Sweden and told me I would have never believed it. And I said, what was that? He said, I would have never believed it until I have actually seen it, that the United States is 20 years behind the rest of the world in medicine at the very least. He said, you are so far behind, you are practicing medicine in the dark ages. All of our doctors and nurses, do you really want to practice medicine in the dark ages? Don't you want to do something to get a better education? Why don't you start talking to your teachers? Try to get teachers in your schools that have come from another school, so there's at least an exchange of ideas. Many of our schools, the professors that we have as we go through school have all graduated from that school. So there is no new exchange of ideas other than what you get out of the medical journals you read or the conferences you go to. Think of these things. Work to change medicine. Work, call your congressman, call your representatives. Get medications taken off the television set. Again, this is Dr. Rick Redalen. I hope you're having a blessed day, and get out and enjoy the sunshine if it's sunny where you are. Take care.